All right. So, hey guys, welcome to the CPD Junkie podcast, where we bring you interviews with the dentists sharing their CPD stories and journeys from around Australia. What better way to learn than to follow those who've already done it before? CPD Junkie is Australia's most comprehensive CPD. So head over to cpdjunkie.com.au and become a member for free to access the full features of the site. I'm your host, Laurence Doan, and tonight we're joined by Dr. Jesse Liang. Dr. Jesse Liang graduated with a Master's in Dentistry from Trobe University. He previously lived in Bendigo, where he treated dental patients in regional Victoria. He enjoyed all aspects of dentistry, having a special interest in oral health education, teaching, research, children's dentistry, and gum treatment. He has also previously been involved in dental volunteering programs in rural Vietnam. Outside of dentistry, Jesse is the host and founder of Odontojam and enjoys playing guitar, recording music, and running. Dr. Jesse Liang, welcome to the show.
Thanks for having me, Laurence. Thanks for the invitation. It's a pleasure to be on.
So you previously did a bachelor's degree in urban planning in Melbourne Uni back in 2012. What kind of compelled you to go from there into dentistry?
Yeah, well, I guess at 18, I didn't know what I wanted to do. So I just kind of picked up the VTAC guide and chose architecture, urban planning and design. Kind of got to the end of that degree and didn't really feel like I wanted to do that for the rest of my life. At the same time, I was working part-time. My mum was a dental prosthetist and she had a denture clinic. So I was actually working part-time, making special trays, pouring up impressions, wax rooms. And I actually applied to dental tech school to do the diploma in dental technology. And it was actually mum who said, oh, hey, Jess, I think you might actually find dentistry more fulfilling. And mums kind of have this thing where they kind of know a bit more about yourself than you do at that age. And so I actually took her advice and then I applied for dentistry from there. I didn't get in the first time, actually, but I sat the UMAT and didn't do too well. It's not really a test you can study for. And you have to read really quickly, and I'm a bit of a slow reader. So I didn't do too well in that. But I then did a year of general health science and then just studied hard, kept grades up, and then transferred across to dentistry. So that's kind of how I found myself from, urban planning to dentistry.
Don't be too hard on yourself. I mean, you did better than me. I did it like at least 2-3 times before I got in. So
I guess, well, we're lucky here in Australia. There's more than one way to get there. So lucky for people like us, I guess.
So tell us about your CPD journey so far. I mean, you've only just graduated recently.
Yeah, so it's about at the end of this year will be 2 years, and you've kind of picked up a lot of CPD over the last 18 months. The first one I did actually coming out of graduating was a surgical extraction course. That was with ARIA, so the Australasian Restorative and Implant Academy. And that's because, in university, as you know, we don't actually get a lot of surgical extraction experience. So I kind of just wanted something to get confidence up to help troubleshooting when, the palatal or distal root breaks of that 1/6. So I did that course, and it's a live patient course as well. So you got to bring a patient in and then do the treatment itself. So I found that was really helpful early on, just to have that increasing confidence boost. And since then, it's definitely helped a lot, especially in those trickier situations. That was really great because it was hands-on as well as live patient. I then started doing a bit of orthodontics. So I'm doing progressive orthodontic seminars. Just over halfway doing that course at the moment, which is really good because, again, in university, ortho, it's like non-existent, as I'm sure you remember. So it's really good to get that extra knowledge that we didn't get going through university. And also I'm doing with the Dental X group, they run a program called the ACE program, which stands for Accelerated Clinical Excellence. And that's a more general degree that covers all aspects of dentistry, endodontics, surgical extractions, again, direct composites, aesthetic dentistry, treatment planning, indirect restorations. And that's a year-long program that's still actually going, that I'm doing as well. So that's kind of been like the initial part of dentistry, and I've done some communication ones as well, outside the clinical aspect too.
Dentistry, is it?
Yeah.
Okay, so let's backtrack a little bit. Did you have a particular structure to it when you decided to pick these kind of courses, or was it kind of more tailored towards, maybe what your practice was doing? Was it recommended from someone? How'd you come across these ones?
Yeah, I guess, well, the nature of the CPD I've done so far is does cover a lot of the general dental aspects. Ortho just didn't have a lot of knowledge in that at that point in time. And I always thought it was interesting. I do enjoy working with kids as well. So it's that kind of works well. And the ACE program that I enrolled in is because it covers all aspects of dentistry, that was kind of a nice one to go into to get a really, really good foundation more than anything else. So it wasn't like I had a specific plan. I just looked at the programs, saw who was running them and what I would like about it, and then kind of approach it from there. Something that I thought would be practical and useful in every day, especially when you're still pretty new to the game.
So was there a reason you picked an ACE one because it was a bit more structured, or did you come from, because the other ones weren't as structured?
The ACE program is, for those who don't know, is headed up by Dr. Anthony Mack and Dr. Andrew Chio. And Andrew was a mentor of mine even in the uni days as well. So there was, that element of, trusting a source, and I've known the way he practices, the type of dentistry he wants to do. So I, figured if he's running a course, it's going to be pretty comprehensive. So that was definitely a pull factor, if I'm being honest. And the fact that, it was it seemed to me like the first of its kind to cover multiple things and have continuing mentorship and following up throughout the year, which has been a great part of the course, especially during lockdowns as well. We've still had engagement with the mentors, and I'm able to send through cases and stuff and discuss clinical aspects, even during lockdown. So having that additional support, I think, was pretty good, especially when you're kind of starting out.
Right. So I was going to ask you, with lockdown having, in most cases, especially in Melbourne, in your situation, that would have limited a lot of CPD that you would have been able to do during that time. But it sounds like because of this particular structured program that you're in and the ongoing mentorship, it's actually been quite helpful.
Yeah, well, everyone's kind of had to be adaptable, during this whole pandemic, and CPD courses are no exception to that. And I think they've done really well given the circumstances. I've been able to do a lot of the practical classes too, especially earlier in the year when Melbourne and Sydney were actually doing okay in terms of lockdowns. But then they've supplemented that with a lot of online as well. So I guess the beauty of having things like Zoom is that you can get a lot of the theoretical knowledge and then just kind of bunch together the practical stuff when we're actually able to do that. So that hasn't affected that experience too much. If anything, they've given us more time, more information. And the only thing I'd say that the pandemic has affected is the orthodontics course I'm doing, progressive orthodontic seminars, because there's practical components to that, but they've now kind of made it on Zoom as well. And so learning practical orthodontics over Zoom on a 2D screen when we're dealing with 3D objects is, it's not ideal, but I guess you're given a lifetime of free resets. So I'll probably end up going back sometime in the future just to review some of that stuff.
Yeah, well, I think I'm seeing programs now are becoming, they send out a kit. And hopefully, with how things are tracking at the moment, maybe they'll be able to send out a kit so that you can work with it and then still do practical whilst having that, a virtual interaction.
Yeah. I've seen, they're definitely coming up with inventive ways. So I'm sure it's definitely going to get better over time. But I think it's just something that all of us have had to deal with in the last year and a half.
So of the three that you've mentioned so far, or any other ones, what's had the biggest clinical impact on your dentistry today?
Look, the ACE program, because it's about bread and butter dentistry, has probably been the most helpful on a daily basis, the most practical. Direct restorative, learning about aesthetic composite work, layering techniques is all stuff that I'm quite interested in. And it's stuff that we do every day. So that would have to be just by default, one of the most helpful ones. Another one that I've done a non-clinical one is actually one on communication. It's a seminar workshop called Case Presentation by Marianne Soriel. And that actually has been probably up there, equal to the clinical subjects, because again, we don't get a lot of communication taught to us in university. And one of the first things to learn in the seminars and workshops is dentistry, at least, in the clinics here in Melbourne, in Australia, it's psychology. We're dealing with patients, feelings, their anxiety towards dental treatment and how to navigate all of that. One really interesting I found was, I'm spending all this money doing all this CPD, but unless you can actually communicate to the patients clearly and actually get them to accept treatment, I'm never going to be able to practice all this awesome CPD that I'm doing. So in order to be a great clinician, you kind of first have to be a good communicator. And that's, so I've taken heaps out of that course too. So that was really beneficial.
Yeah, I definitely think communication is definitely a recurring thing for a lot of new graduates coming out. I mean, for us Adelaide graduates, we're pretty lucky. During my time when we were going through uni, we had someone who, her name was Dr. Vicky Skinner, and she was teaching a lot about communication in Adelaide. But for a lot of us at the time, we weren't really taking that in. So I mean, until we graduated and started attending some more of the communication programs, we realized, a lot of my friends as well, that we actually had some of this and we should have paid a little bit more attention to it. But yeah, communication, definitely.
Yeah, 100%.
So who would you say has been your biggest mentors or idols or inspirations in your career path so far, and why?
Yeah, I mean, I mentioned Andrew Cheo before. I met him going through university. He was one of the demonstrators there, and from the first day that he started demonstrating for us, you could see probably the most significant part was how passionate he was about dentistry. Like, I've never seen anyone so passionate about it. But he's also passionate about teaching, which I think is important too, because you can be a great dentist, a great practitioner, but unless you know how to teach, you can't really bring someone else along with you. So yeah, we'd be seeing a patient, and then mid-treatment, he would say to the patient, "Hey, can I just show the student a presentation?" And then he would take us through a composite layering presentation, with the patient there. So yeah, a really great way to inspire people to want to learn. And he's very generous with his time, and just an incredible clinician. So definitely someone that's impacted me, even before graduating. Andrew, another person clinically is I work at a clinic in Brunswick, and Dr. Angelos Sorial is a principal dentist there. And so yeah, he's been definitely a great mentor, especially over these last 6 months. I remember when I interviewed for the role, the interview we both started talking about how both of our wives think we're both too addicted to CPD. So we kind of hit it off on that front. But yeah, every day is kind of like a learning experience there at work, and it's always good to have someone give you feedback on your work. He's not afraid to tell me if he would have done something differently. And I find having that kind of close mentorship is really beneficial on a daily basis. I guess beyond dentistry, I mentioned Mum before. I mean, she had her own denture clinic, and she was one of the first female dental prosthetists in Victoria. And that came with its own struggles at the time. And I saw her, she'd be doing 8 a.m. till 6 p.m. and come home and still did her own lab work, working till 11, 12 p.m. just to get all the work done. And, looking back now, I work, just in the daytime. I don't really work much in the night. It's kind of inspirational to see how much, despite, extra barriers that she had to go through to get you where she got, to actually kind of push through. And that determination, I think, is something I've definitely tried to carry over into my practice too. And maybe, my dad's actually a martial artist, and he practiced at pretty much the highest level that you can. And to see someone really focus and hone their art is inspirational too. And it's kind of, I've tried to bring that in, because dentistry is as much art as it is science. So I've tried to take a bit of his philosophy and his approach to dentistry as well.
Fair enough. I mean, for some of our viewers, your dad is a social media influencer, almost, hey, isn't he? He's showed up on Lad Bible from martial arts. He's even appeared for Peking Duck.
Yeah, it's kind of one of the positives to come out of the pandemic. Funnily enough, my sister and I were just joking one day. There was that bottle cap challenge going around like 18 months ago, and we just said to Dad, "Hey, Dad, we know you could kick the bottle. Why don't you kick 3? It could go viral." I mean, we just dropped it casually, and he didn't think anything of it, but we made him do it. And then it did go viral. It got like 4 million views in a couple of days or something. And then since then, my sister kept uploading videos of him to TikTok, and then I started uploading his stuff to Instagram. So we both kind of managed one of those for him. And then he just kept having videos go viral more and more. And eventually, the group, the Aussie duo Peking Duck, got in touch with him. And it all just happened. There was no real intent for that to happen. So it was just one of those nice positives to come out of lockdown, as hard as it was for everyone. So yeah, it's I don't think he ever thought anyone would refer to him as an influencer, but Yeah, yeah.
The Melbourne Jackie Chan.
The Melbourne Jackie Chan. Yeah, so that was yeah, so that's been really cool. If you want to check it out, Instagram at The Way of Chi, just and on TikTok it's at Zara Liang, which is my sister's name. If you're interested.
So I want to come back to these mentors. You know, I think there's a reoccurring theme here. A lot of the people that you kind of associate yourself with, that's been a big influence on you, are people who are quite passionate about their dentistry. You know, for a lot of recent graduates, would you say that, you know, finding who kind of struggle sometimes to find if they can find someone who is passionate in dentistry, that will be able to reignite some of that passion? I don't know if that happens with some of your other friends, maybe, or who've struggled through dentistry and trying to find someone, and start to lose that drive and that passion. But, you know, from what I'm hearing, that these people who've had a lot of passion for stuff for dentistry has been able to keep your passion for it too.
Yeah. I mean, that's the inspirational part. Like, I always thought that a teacher is someone who obviously understands and knows their craft really well, but is still excited by it. And if you surround yourself by people who are as excited about whatever it is you're doing, like in our case, dentistry, then it's infectious in that way. And then it inspires you to want to, even though you're not at their level yet, as the level of your mentors, it's something that, you know, the key word is yet. You want to get there eventually. And so as long as you've got people around who are constantly motivating you, then it's kind of hard to not be motivated, if that makes sense.
Yeah. Your mom being a technician, you know, you see her doing all the hard work. For a lot of dentists, they send the lab off work, and then they just, you know, there's always that disparity between that communication between, you know, understanding what's happening on their end and what you're doing on your end. Having come from that kind of background, do you think that's been able to help your understanding of that disparity?
Yeah, and now I just try to send the lab as much information as possible, because I mean, I used to even see some of the lab sheets that would come back from a dentist to mum, and like you'd be like, well, it's not really clear what they were even asking for. So I think if you try to make the lab's job easier, at the end of the day, it's made easier for you too. So I'll typically take photos of the case and then send it, you know, with shade tabs and everything, if it's for indirect restoration, and kind of drawing arrows and stuff just so they can know as much as possible what I'm trying to say. And I think I hope that's appreciated. I know mum said she'd appreciate if they did that more often. I guess back then as well, the digital dentistry and photography wasn't as available, but now it's pretty quick to do just on the iPad, send it through, and yeah, hopefully at the end of the day, it means it's easier for everyone.
So you take a photo and then you just kind of annotate it on the photo, and then you just send it through as a file, or do you kind of get a new piece of paper and then draw it out and then illustrate where you want to?
Oh yeah, so you take a photo on a DSLR, upload it to the iPad, and then just on the Sketch app in the iPad, and just draw things, send it in an email, and just say refer to, I know, red arrow pointing there, and I want something that looks like that, if that makes sense. Yeah. Like not every case requires that, but having the ability to do that and making sure nothing gets lost in translation or anything like that is quite beneficial.
So, have there been any particular struggles in your CPD journey so far, and that some of our viewers might not be aware of?
I mean, I kind of talked about it before in terms of, you know, trying to learn a hands-on activity over Zoom is hard with the orthodontics course. Like, you know, they do their best to try and make it happen, but you know, when they're holding up a model to the screen and then you're trying to hold up your model, but then there's lag in the internet, their camera is not as clear as your camera, you know, it does make it a little bit more difficult over Zoom. In terms of other struggles, not really. In terms of the actual CPD content, it's actually been really good so far. Yeah.
So, you know, a lot of new grads or recent graduate generations right now, you know, with abundant of information online, social media, do you think there is, it's affected their mindset in terms of having to try to do things a lot quicker? I mean, you've done, like you said, oral surgery, you've done ortho. Do you think that that's had a sort of influence in how you've approached or how quickly you wanted to get through and then learn all of that?
Yeah, I guess there is an element of that, of wanting to catch up or just kind of be up to date with everything that everyone's doing. I think you can definitely do too much and kind of stretch yourself too thin. And so I'm trying to have to be careful to not overdo it. So you can actually focus and on what you're actually learning and not having to think about so many things at once. I think with social media, I mean, it's actually talked about a lot, that, the cases that are posted, they look incredible, and they can make the work you do feel not as good, or a bit inadequate. But I think we don't actually see how many hours were put behind that. And it's not going to happen overnight. And I think you can throw as much money as you like at CPD, but still a lot of it is going to come with the hours that we put in on the handpiece. So I think just have to remind ourselves about that eventually you'll get there, just even if it's not yet. And maybe one day you'll be able to do that same aesthetic restoration. So I'm still waiting for that day. So.
So what would you say your current ideal clinical day kind of looks like? The type of procedures that you are doing?
Yeah, I mean, I like variety. Still, everything at this point is interesting. So I guess if I had to pick an ideal day, maybe 7 to 9 patients. Half of it would be restorative, a mixture of direct and indirect restorative. Maybe the odd extraction and a new patient exam as well. Yeah, and I kind of all chucked in with a little bit of ortho would be nice too. So I find the variety keeps things fresh. It keeps it's not as monotonous. If you had to just do clean for the entire day or just do extractions for the entire day, I reckon you'd be quite tired. But that's for some people. But I really enjoy the variety of all the aspects of dentistry at the moment.
That's good to hear. So even dentures, hey?
Even dentures.
So share with us what you hope your ideal clinical or non-clinical day would look like in 5 years' time, and what kind of CPD do you want to do to kind of get towards that path?
Yeah, I mean, in 5 years' time, it's a good question. I would say maybe 5 to 6 patients, but doing really comprehensive treatment. Like whether it be working towards full mouth rehabilitations, doing really comprehensive treatment that you've worked on initial stabilization, maybe getting perio under control, and eventually progressing that patient who was hesitant about certain treatment to doing the comprehensive treatment plan, and then actually executing it. And I find if you're focusing on 5 or 6 patients, I find it easier to focus, whereas some people like really packed back-to-back books and just churning through. I kind of like to be a bit more focused on less, if that makes sense. Kind of less is more in that sense. CPD wise, I haven't really dabbled in implants, but everyone I've spoken to about that has said, you shouldn't dabble with implants. You really need to dive in. It's not, that's safer for you, safer for the patient to do it properly. So, I'm probably a couple of years away of trying to begin that journey, but that's something I see myself doing later down the track. What structure or form that's in, whether that's a structured university diploma or a well-known reputable program, it'll be one of those two. I imagine, but I think I'd like to incorporate that into my daily workflow as well down the track though.
Yeah. So how about non-clinical side of things? What do you want to do in 5 years' time?
You just mean outside of dentistry in general?
Yeah.
I really enjoy playing music, playing guitar, writing music. My wife and I, we perform at weddings together. So it's kind of a nice break from dentistry. As much as I love it, you got to do something else as well. It can't be everything. So yeah, hopefully we keep playing music, maybe buy a couple of extra guitars, and I still keep up with the podcast as well, as I love talking about dentistry even when I'm not in the clinic. So it's just kind of interested in a lot of things. So, but those are the main things that I'd be doing outside of dentistry, I'd say.
Yeah. Well, I mean, if you wait a little bit longer, all your friends around you might start to get married, and then you might be performing at a lot of dental related weddings.
All right. Yeah. So another way to tie dentistry into my. Yeah, that's a fair point. I'll have to remember that.
So you did some dental volunteering in Vietnam. Tell us a little bit about that.
Yeah, I was actually in my final year of dental school, and myself and 2 other students got to go on a volunteering trip, and it was actually headed up by some of your listeners may know Dr. Adrian Dang and Dr. David Trin, and it's basically a program where you go to regional areas of Vietnam and you treat kids, they don't have access to general dental treatment. So typically the ages are about 10 to 12, that primary school, just before high school kind of age. And you're treating kids who have really high caries rate, a lot of not a lot of access to fluoridated toothpaste and oral hygiene products that we take for granted. And the type of dentistry you're doing is a lot of ART, so a lot of GIC, silver diamine fluoride, and pretty fast paced too. Like there's a lot of kids to get through, but incredible experience, especially when doing it as a student. Like you get back and you just feel so much more confident because you've just gone through so many preparations, removing caries, and it just becomes a bit more second nature. And part of that program too was oral health education. So we spent time with the kids, and pretty amazing how, even though I don't speak Vietnamese, but you're still able to, I guess, human to human, you're able to have that connection, and the non-verbal language that we all share. It's amazing that could still come through in a clinical setting. It was a little bit daunting at the start. You've got a 12-year-old boy that doesn't speak any English. I don't really speak any Vietnamese, but still managed to get through a procedure, do 5 or 6 restorations. And so it kind of showed me how much we take for granted the materials and the access. I've never missed rubber dams so much in my life than there, because like we didn't have a proper suction unit. The suction was, they would bend over, and they would bend over the side and spit out the saliva and the contaminants, instead of actually having a suction unit. So yeah, it just not ideal working conditions, but you tried to make the best of the situation. And it was a really, really good experience.
Wow. Yeah. I mean, I was able to do a bit of that as well in Cambodia in my final year as well. And definitely, I think the language barrier is one of the hurdles, but to see the cultural difference in how they tolerate whether you do something with that LA or just the mindset, and they're just so happy that we're there to kind of help them, is definitely one of the eye-opening experiences I think any student or dentist can experience. And if they do get the opportunity after this whole COVID situation, I definitely would recommend that too.
Yeah, I found that too. When I was first told that we do deep restorations without local anesthetic, I didn't believe them. But it turns out that it was that way because the kids were more scared of the needle than they were scared of the pain of removing a deep carious restoration. So that just blew my mind. These kids are so brave. And when you kind of came back here and then you see the kids complaining about just a clean, you kind of, it makes you wonder.
Yeah, it does, doesn't it? Well, Dr. Jesse Liang, thank you so much for coming on the show. Hopefully we'll be able to get you back in the future after a few more years, and then talk about how things you would compare back to now. If you could let the people know how they can reach out to you, or kind of what's kind of going on in your life.
Yeah, I mean, it's I've run my own podcast called the Odontojam podcast, so you can check it out on Instagram at Odontojam, or Apple Music and Spotify as well. Basically just talking to a lot of people who have been my mentors, and a lot of people in the industry. And what I've just found is people in our profession, we're incredibly fortunate. Everyone's happy to share about things that they've learned and things that they think will be useful to other people. So yeah, that's what I've been doing. I started that in lockdown last year, which was really fun. I also upload music and stuff that I write too. So if you're interested in that, you can have a look at Jesse Liang Music. But yeah, thanks for having me on, Lawrence. It's been really great.
No, it's been good. Yeah, I've been loving your podcast as well. You're into your second season at the moment. So is that right? Yes.
Yeah. Second season. Yeah. So, season 1 last year, season 2 this year, one every month, try to balance that CPD and work. So, but no, it's been fun. I do enjoy it.
You're a hustler at heart. I can see that already. It runs in the family.
Thanks, Lawrence.
All right. Well, have a good evening. Hey.
You too. Take care.